So what is it? Girl, I don't know. It's a pregnancy test. No, it's not. Menopausal women don't get pregnant. Well, Clearblue. It's Clearblue. I know. It's a test to tell you if you're in menopause. Hi, I'm Dr. Rahman, and just to let you know, this is not about a pregnancy test for menopausal women. Maybe you've seen it already. It looks like a pregnancy test, but it's not a pregnancy test for menopausal women. It's a Clearblue Menopause Indicator. Clearblue has produced home pregnancy tests. Clearblue has produced ovulation tests for women who are trying to get pregnant. And now Clearblue has produced a menopause indicator test. Have you seen it? There's an app that you download. It's called Clearblue Me. Clearblue Me, menopause indicator. You log in and establish an account. Once you've established an account, it will ask about your medical history, focusing on your menstrual history, asking you about your cycles. How often do they come? Are they regular? And other symptoms you may or may not be experiencing. The next step is to provide the results of the FSH testing. So there are three things: age, menstrual history, and the results of the FSH testing. Based on these results, you will be provided with a report which shows you where you are most likely in terms of, are you premenopausal, perimenopausal, or postmenopausal. And then there's information. It doesn't provide any type of treatment. They do give the proviso that the diagnosis of menopause can only be provided by a health professional. So how does this work? I just want to talk about the science behind it. So let's talk a little bit about menopause, because many women are stating that they do not understand what is happening to their bodies. I like to preface this by saying menopause is not a medical problem. Menopause is a physiologic change that all women will go through if they live to a certain stage of life. Again, menopause is not a medical problem. Women may sometimes experience effects due to these physiologic changes, and for that reason may need medication or further evaluation. But the main female hormone is estrogen. Estrogen is produced primarily by the egg follicles in our ovaries. Over time, the egg follicles are depleted, and our estrogen level will eventually start to decline. And when that happens, we can sometimes become symptomatic, experiencing things such as hot flashes, night sweats, difficulty sleeping, difficulty concentrating, vaginal dryness. And that menopause is a moment in time when you have gone 12 months without a menstrual cycle. Anything after that is considered post-menopause. So the average age of menopause is 51 in the United States. So let's take a look at this diagram. We can see that while we are reproductive, having menstrual cycles, our estrogen levels, our level is high. It stays high, and then as we approach menopause, we see that our estrogen level declines. And often the question is there a way that we can tell if we are menopausal? And one of the things that we can do is check with FSH, follicle stimulating hormone. The follicle stimulating hormone will start to increase as we approach and enter into menopause.
At this point, I need to make a clarification. A woman is either premenopausal, perimenopausal, or postmenopausal. Menopause is when a woman has gone 12 months from her final menstrual cycle, and at that moment, she is experiencing menopause. Anytime after that is postmenopausal. Anytime before that is pre or perimenopausal.
Is it for you?
You will need to download the app, purchase the FSH test, establish an account, enter your private information, perform the FSH test on the first void of your urine specimens every other day over a 10-day period, and then enter all your results. And it is not for everyone, not for those with polycystic ovarian syndrome, not for those that have had a hysterectomy, and not for those who are on hormones or medication which may have affected their hormone levels.
The app will provide more information about menopause that you have access to, but it does not provide treatment. It basically will tell you that you need to take your results and go to your healthcare professional for the ultimate diagnosis of whether or not you're pre, peri, or postmenopausal. And then based on your history and or any symptoms, treatment may or may not be indicated. For a woman who just wants more education, I think a good source is just going online, but if you want to have an app specifically for menopause, not a bad idea. Is it for everyone? No. It may help you to have something to present to your health professional when you need to consider whether or not you want to consider hormonal replacement or alternative treatments, where you can discuss other symptoms which you may or may not have seen as related to menopause. Is it worth it? Is it worth it? If you're someone that likes having more information, by all means, it's not going to harm you to do this test. The recommendation is that you should then take the results to your health professional for further discussion. So it's information that's readily available. It provides other educational information that may be helpful to you. What it doesn't do, it doesn't give you anything definitive. It can't diagnose it. It says that's left to your health professional. And it doesn't provide treatment. It doesn't necessarily talk about treatment options. And there are multiple treatment options.
So there you have it. 5 stars to the producers of Clearblue Menopause Indicator for wanting to educate women regarding menopause. And that's the primary function of this app. It educates you about menopause and it gives you an estimate as to where you are in terms of your menopausal status, pre, peri, postmenopausal. The recommendation, always check with your health professional.